I'm Dr. Mark Kiker. I am the inventor and designer of the Heat Treat Active Warming Blanket that we're going to be discussing today. As far as my background, I am a board-certified anesthesiologist, work here in Indianapolis. I'm the director of the operating rooms at the Indiana Heart Hospital.
The most common complaint I hear from all of our patients is the temperature in the OR. You try to explain why you have to have it so cold because of the lights, but everyone comes back, they're shivering, they're freezing, they all think it feels like a freezer.
The design of the Heat Treat blanket enables us to simply place the heat treat on the patient as you would a normal blanket when the patient comes into the facility. The blanket then very simply just stays with the patient, is transferred with the patient to the operating room suite and then to the recovery room area. There's no attachments, there's no hoses, there's no electrical requirement, there's no noise involved, there's really no risk of airborne pathogens from the hoses. It's very different than what we have currently for active warming devices.
One of the things that I really like about the Heat Treat blanket is I put it on the patient preoperatively and then they can keep it the whole time, so we don't have the use of all the cotton blankets.
The Heat Treat blanket is designed so that after 20 minutes on exposure to air, it will heat up to an average of 40.5 degrees centigrade. The maximum temperature designed to not exceed 43 degrees centigrade. The exothermic reaction will continue on for approximately 12 hours. We want to make sure that when the patient is on the operating room table, the Heat Treat blanket is placed over the strap with the pockets up. The Heat Treat was also designed so that you could use the blanket in different formations for multiple surgeries. When the patient is initially brought into the facility, it will be placed long ways with the pockets up. When the patient enters into the operating room, for instance, if they're going to have a knee scope, then we would rotate it and use it as an upper body blanket that would just cross over the chest and torso and the arms. As soon as the operation's over, then it can be easily rotated 90 degrees and placed over the patient, and then the blanket follows the patient and stays with the patient to the recovery room.
They really like it. You feel like it's warm and it's comforting, and it stays warm a long time, so I think they really like that aspect of it.
Patients commented that it was a lightweight blanket to use, that it was warm, comfy, they could cuddle up in it. They really enjoyed using it.